I'm Tushani Baloha from Our Lady of Fatima University, and today I will be demonstrating the musculoskeletal system. But after that, first I'm performing hand hygiene for us to prevent the spread of microorganisms, and second is provide also the patient's privacy so no one from outside can able to disturb the patient from doing the assessment, and introduce ourselves and verify the clients, identify we're going to explain to the client and what we're going to do, why is it necessary, and how he or she cooperate. Come in. Good day, ma'am. I'm Trishani Baloha and I will be your student nurse for today. So may I ask what is your name? Ryan out here. Okay. How about your age? 19 years old. And your birth date? March 9, 2004. Okay, so thank you so much. So today, ma'am, I will be assessing your musculoskeletal system. So that's your muscles and joints. Okay, but before we proceed, I have some following questions. So first, do you ever had any history of joint disease? None. Okay, none. How about arthritis? None. Okay. Any other problems with your joints? None. Or muscles? None. Or pain that we should limited movement that should know about? None. Okay, no. Okay, so ma'am, first I'm going to start with your temporomandibular joint. Okay, so can you open your mouth? Okay, and bite it. Okay, and chin out. And in. Okay, side to side. Okay, so what I'm palpating for is any clicking or crepitation. Okay, so mom, do you feel any clicking or anything abnormal with that? No. Okay, and any pain with doing that? None. Okay, so for each joint, I'm inspecting and looking if I see anything abnormal, redness, swelling, muscles, and I'm palpating for anything abnormal, clicking, crepitation, and then I'm looking some of joints, so I'm going to check for movement and for strength. So I do that for each set of joints. So next, we're going to assess the spinal. Okay, so your spinal, ma'am. So there's a little spine. Okay, so tayo po tayo, ma'am. Okay. Talikod po. Then just put your chin into your chest. Okay, so I'm just going to palpate the spinal processes in the neck all the way C1 to the C7, okay, which is very prominent and it's very easy to know, okay, and I can feel that is straight, okay. Okay, so bubo tayo ulit, ma'am. Okay. Okay, and then I want to check the range of motion of your neck. Okay, so can you put your chin to your chest? Okay, and then back at the ceiling. Okay, and turn your head side to side. Okay, and put your ear in your shoulder. In your shoulder. Okay, then I'm gonna test your strength. Okay, so can you turn your head against my hand? Okay, and on the other side. Okay, so ma'am, that's normal range of motion and strength for your neck. Okay, so moving down to the shoulder. Tayo po ulit tayo, ma'am. Okay. So ma'am, for your shoulder assessment, kaya nyo lang po ako. Okay, so side po natin yung kamay natin. Then up. Okay. Then papunta sa head. Okay, and then down. Okay. And then swing. All the way, okay, and up, and down, okay, then, punta sa back, okay, good, so, relax, okay, and then, lift your shoulders up against my hand, okay, good, that feels nice and strong, okay, and any problems with your shoulders? And I'm palpating for anything abnormal. Okay, any pain or tenderness, ma'am? No. Okay, and I'm going to move down. Okay, and I'm going to palpate your elbows. Okay, so wala naman po akong nakikitang abnormalities, ma'am, sa elbows. Okay, that's good. And then I'm gonna have to bend your elbows up. Okay, and put them down straight. Then hold them out like this. Turn over. Turn over. Alright. Okay, and now I'm going to check your strength of your elbows. Okay. Pull toward yourself. Okay, and to the other side. Okay. Okay, so her range of motion in her strength in her elbows is normal. Okay, so now I'm going to have you put your hands out like this. Okay, and I want you to put your wrist down and your wrist back up, and then spread your fingers apart. Okay, and put your fingers back together, and then put your hands out straight and just your fingers down and up. Okay, and then put your hands over. Okay, and bend your fingers, and I'm just checking the strength of your fingers. Okay, good. Okay, and I'm going to do over here. Okay, so I'm checking the strength. Okay, and I'm also going to palpate. So this is very importantly in palpating the wrist and the hand, and there are tremendous number of bones here. Okay, so you want to really do a good job with palpating all of these joints. Okay, all the way down the fingers. Okay, I do not feel anything enlarged. Okay, so good and normal. Okay, so now ma'am, hihiga ka naman po. Okay, para mapalpate ko po yung hips. Okay, so now I'm palpating this side, your hips. Okay, may nararamdaman pa pong pain pag pinapalpate ko yung hips. Okay, that's good. So now ma'am, for your leg, I want you to move out your leg. Okay, then back in, then lift it up. Okay, then down. Okay, and I want you to bend your knee. Okay, bend. Okay, then come in, come out. Okay, and down. Good. So for your leg naman, ma'am, I want you to move out your leg against my hand. Okay, then push it against my hand. Okay, good. Okay, so same din po sa kabilang leg natin, ma'am. So I want you to move out your leg. Okay, then back in. And lift it up. Okay. And down. Okay. And I want you to bend your knee. Okay. Then come in as far as you can and come out as far as you can. Okay. Good. Then down. And now I want you to move out your leg against my hand. Okay. Good. And push it in against my hand. Okay, so that's good. So now I move down to your feet. Okay. Okay. Then I'm going to palpate again with the feet and ankles. Okay, there are a lot of bones in the feet and ankles. Okay, all the way down to the toes. Okay, then same thing both. Then same thing both feet. Okay, make sure that you palpate all those bones. Okay. Okay, and then push against my hand. Okay, good. And then pull up against my hand. Okay.
And then I want you to put your toes together and leave here. Okay, and can you put your toes together like that? Good. And can you put them back out? like this. And then can you put your feet together like this? All right.
Okay, then sit up. Okay, and then we're actually going to go back to your knees, okay, at this point. So, I'm gonna palpate your knees. Okay, so any problems on your knees? None. Okay, anything when you walk? Nagbabike po ba kayo, ma'am? Okay. So now, ma'am, can you straight out your leg? Okay, then bend. Okay. Okay, then push against my hand. Okay. Then pull. Okay, good. Okay, and next, push against my hand. Okay, then pull. Alright. Okay, so now, ma'am, tayo pa po. Okay. Then put your hands there. Okay. Then, and put your leg out straight as it will go. And bend your knee up as far as it will go.
And now I'm going to be looking at your spine. Okay, so I'm palpating all the spinous processes all the way down the back. Okay, all the way down, all the way down. Okay, after palpating the spine or before, it doesn't matter which order that you do it in. We're looking for the straightness of the spine. We're looking for symmetry for shoulders and scapula, the hips, and the gluteal folds. And then we are also, can you bend over and touch your feet? And when she bends over, we're looking for symmetry of shoulders and scapula, and we should see a C curve. So the spine should be curved like this, okay, during that bending over. And then can you stand back up, please? And then we're looking at the spine from the side. What we are looking at is that the thoracic spine should have the convex curvature, and then the lumbar should have the concave curvature. So you see, you have a curve, and that's a normal curve of the spine.
Okay, so I'm also going to check range of motion of the spine. Okay, so can you put your hands on your hips? Okay, and bend side to side. And bend side to side. Okay, and without moving your hips, can you turn in this way? Okay, and this way. Okay, good. And I think we've checked out all your muscles and your joints. They all seem to be in good shape. So that is the end of our assessment. So thank you for your cooperation and thank you so much. God bless you.